Medical coding has been in existence for 150 years. It takes the descriptions of diseases, illnesses, or injuries and procedures found in many kinds of written medical documentation and converts these descriptions into numeric or alphanumeric codes. Originally, coding was performed to classify mortality or the cause of death information to keep statistical records. Today, both mortality and morbidity or non-fatal disease information is converted to diagnosis codes, and services provided for patients are converted to procedure codes. These codes are then used to submit information to insurance plans for payment purposes. The most important thing for a coder to remember is, if it is not written in the medical documentation, you cannot code it. Another way to say this is, not documented, not done. The two questions a coder has to answer about every case are, what was done for the patient, or what services were provided, and why was the service provided? To code the what, coders use the CPT-4 or Current Procedural Terminology 4th edition book to record the service provided. To code the why, coders use the ICD-10-CM or International Classification of Diseases 10th Revision Clinical Modification book to record the diagnosis. The diagnosis is the medical reason for the service provided. The current version of the CPT is the most recent version of a document that was first used in 1966. In 1987, Centers for Medicare and Medicaid Services, known as CMS, mandated that CPT codes be reported on all insurance claims. Previously, you covered the introduction to diagnosis coding in class, and we'll study how to combine the use of ICD and CPT codes in a future class. CPT codes are used to submit insurance claims to assure providers receive appropriate reimbursement for each service they provide for a patient. The panel responsible for the maintenance of the CPT is known as the CPT Editorial Panel, which is part of the American Medical Association, known as the AMA. They approve changes to the code's descriptions and guidelines used to describe procedures and services performed by physicians and other healthcare providers. New CPT books are published annually and placed into service January 1st each year, so it is crucial to always code with the most current version of the manual. Generally, those who excel at coding are people who like to read and are comfortable doing the research necessary to make sure they're using the information provided to select the most appropriate code for each situation. It is important for you to become comfortable with your code books. You should make notes in your book that will help you as you work. The notes should be recorded in the book itself. The next video will discuss how the CPT-4 book is organized and provide an example of how to set it up for use.